Innovation for a healthier future. Today I'll be talking about how we can transform healthcare in the era of Healthusiasm. Hello, my name is Christophe Jauquet. I'm an author and a keynote speaker. Basically, I'm a business strategist for a healthier, more sustainable future. Every day, every month, the whole year long, I travel around the world to inspire companies about how they can innovate for a better, healthier future. But at the core of everything that I do is one single belief, and that is that health and happiness are the single most important things in our life. And so every day what I do is I look at trends in society and technology and business, and I look at how that impacts our health and well-being. But I also do the opposite. I think about how our health and well-being, the way that we go about our health and well-being, influences those trends in society, technology, and business. And so I write newsletters every 2 weeks about all of these trends that I notice. And eventually they end up in books like these. I've written 2 books. I published 2 books. One is called Healthusiasm. It talks about why we are so occupied with our health today. And the second one is about trends in the transformation economy. And those are the 2 things that I'll be talking about today. I'll be talking about what this Healthusiasm is, and I'll be talking about these transformations. How is it important for you as a company, as an organization? But at the core of those 2 books, at the core of everything that I do, is also this one single belief. And that is that I don't like the word healthcare. And why is that? Is because I think it's too much an on and off switch. You know, sometimes if we are sick, we step into the system, we are in the healthcare system, and then when we are supposedly healthier, then we go out of the system. But I don't think that's true, because people are always occupied with their health. So if we think about taking care of your health, I think that Healthusiasm is a better word, because Healthusiasm really showcases how we all want to be healthy and happy. It's the aspiration that we all have to become healthy and happy. And so this may sound new to you maybe, but I don't think it is, because ever since forever, basically, people have always been occupied with their health. They've always wanted to be healthy and happy. If you go back to, the old Greek time, well, people brought offers to the gods, like Asclepius, to be healthy and happy. So it's always been the case that people wanted to be healthy and happy. So why do I say that now we have this form of Healthusiasm? Well, everything changed in the 80s with this lady. You might know her, you might know Jane Fonda. Maybe you recognize these papers on the wall, maybe you recognize this type of TV. Well, Jane Fonda in the 80s, she was actually the first person that motivated people to take care of your health. This was the first time that people actually exercised to be healthy and happy. People took actions in their own hand. They really wanted to become healthier and happy, and they did something themselves. And that was pretty remarkable, because if you think about it, we just came out of a time where cigarettes were still sold like this, where doctors were actually the ones that said, maybe you should be smoking this cigarette. We came out of a period where cigarettes were still sold bedside. But as from the 80s, what we've noticed is that people stop smoking. They stopped smoking ever since, and it's going down ever since the 80s. And that's not a surprise, basically. It's not a surprise that people were occupied more than ever with their health as from the 80s. It's because in the years before, between the 60s and the 80s, we saw a rise of death rates. Death rates that were related to cancer, death rates that were related to cardiovascular diseases. It's something that we never thought of, something that we even never heard of. But as from the 80s, it really became top of mind of pretty much everyone. And so as from the 80s onwards, what we noticed is that these type of workout videos, they showcase that people wanted to have an impact on their own health. And we saw this ramping up. More and more people were taking actions until today we are in this era which I call Healthusiasm. But you can see in this graph that it really goes up very smoothly and even steadily until the 1920s and even after that. And there's 3 reasons for that. It's not just the workout videos by Jane Fonda, obviously, but there were 3 more reasons. First of all, we have more information, but we also have access to social media where we can share with others about our health. And we also have technology available which allows us to impact our health even more. Now let me briefly go into that here. Now, if we think about information and what information has, what information shows, well, you should know that today, if you ask people, and this is what Ipsos did in 2023, well, 83% of people say that they want to have more control over their health decisions. Now, if you want to have more control over your health decisions, it requires to have more information. And more people are going online, are going to ChatGPTs, are going on to Google to really understand what information do I need to be able to take those health decisions. That's the first element that changed. The second element was social media. If you look at healthfluencers online, medfluencers on TikTok, for example, well, they influence people quite heavily. 40% of people with chronic diseases today say that they change their habits based on the information that they are receiving on social media like TikTok. And there's even a third evolution, which is of obviously technology. And these are simple things that I'm showing here. I'm talking about wearable health trackers. I'm talking about health apps. Well, 1 in 3 people are actually using those wearable health trackers. And 1 in 2 are using health apps. So today, we have a lot more tools to actually take actions and impact our own health. Because in the 2000s, Dr. Google came out. Mobile solutions came out, wearables came out. And this is what we've seen over the years. And this is why this Healthusiasm grows. This is why people are more than ever taking actions to impact their health. And obviously in 2020, something else happened, which was COVID, where people even realized more than before how important their health is and how they themselves can have an impact on having less risk of catching COVID or any other type of disease. So what we see in this graph is that more and more people are taking actions to impact their health. This is what I call Healthusiasm. It's the aspiration that we all have to become healthy and happy. And so that's why when I'm talking to the healthcare organizations, when I'm talking to healthcare providers, the one thing that I'm always saying to them is this: you need to stop saying that patients are not engaged with their health. You need to stop saying that patients are not engaged in their health, because they are. They have a massive healthusiasm. And this is what we see. If you look online, if you look at the search terms for self-care, well, it's quadrupled between 2007 and 2017. That's how much they want to take care of themselves. But then after 2017, it doubled again. Self-care is super important. Wunderman Thompson even coined it, saying, this is the era of super self. People really want to take care of themselves. The self-care trend gets supercharged. And actually, it's a 4.7 trillion business that we are seeing in this self-care space. This is the wellness economy. People are no longer just reactive. We are more and more proactive. In fact, almost half of the population says that on a regular basis, they are taking proactive health and wellness decisions. What's more is that almost 9 out of 10 people say that they are taking more actions related to their physical, emotional, and mental well-being than they did a year ago. So we are seeing a lot of healthusiasm. And with this healthusiasm, I think it is the perfect time to innovate. It's very important to use this opportunity, to use this healthusiasm and innovate in healthcare. It is super important because our healthcare system is broken. On the one hand side, we might have physicians who have too much work, who basically are burned out. And on the other hand, we have long and longer waiting times. This is a huge problem. We have a bottleneck right now in healthcare that we need to solve. And I personally think that one of the major issues there is that we are struggling with health services. Why? Because they are too expensive. They are not scalable. And on top of that, they provide a very bad experience, and very often they're not engaging enough. So if healthcare services cause these kind of problems, I believe that we need to get rid of all the healthcare services. Which is a bold statement, of course, but think about it. What if we would get rid of all the healthcare services and we would turn them into products which are less expensive, which are more scalable? Or what if we could turn them into experiences which are better than the experiences that we have today and that are most likely way more engaging than the services that we are providing? we need to transform all the healthcare services to create the right value again. And this is exactly what I'm talking about in my second book, The Transformation Economy, where I say that we need to create more engaging values for our customers, for our patients, for our health consumers. And so you may wonder, okay, great, how do we create that value, that more engaging value? Well, let me showcase how it is done. And I'd like to go to the fitness industry, because if we go to the fitness industry, you can really understand how value is created over time. Have a look at this product. These are halters. You can buy them for about 20 euros in any sports shop out there, Decathlon, whatever. For 20 euros, you can do a workout your entire life with these halters. It's 20 euros. That is the value that you are willing to pay for. Now, if you go to a gym, well, they bought it for you. It's a service, right? They bought these halters and even a lot of other stuff that you can work out with. And so the value to you is higher. You're willing to pay 20 euros per month now just because it provides that value to you. It's more valuable. Now, in the last 10 years, what we've noticed is that there is this growing interest and growing groups of spinning classes, which are experiences. And there you don't pay 20 euros per month, but you pay 20 euros per session. And so in the gym industry, what we've seen is that there is a growing creation of value. We went from products to services, the gym industry, to even experiences. And this is the experience economy that we always talk about. Now, if we go back to what I said earlier, that we need to get rid of all the services, well, in this case, it means that we need to move from the service to a product, make sure that it is maybe demands less engagement, but that it is more scalable, or that we need to turn these services into experiences. Let's have a look at this. This is a gym. This is a service. If you would turn this into an experience, then it would look like this. You saw in the previous slides somebody in the back there sitting on a bike. Is this a great experience? It is a service because the bike is bought for that person. But this, on the other hand, is a more engaging experience. It's better, it's more fun. And so in a way you can compare this with maybe the hospital institutions or the healthcare institutions today, and this is how it should be. A better experience that is more engaging. Now, let's go back to that service, and maybe we should think about not only moving it into an experience, but maybe we should think about moving it to people's homes. Maybe we should turn it into a product which is less expensive and which is more scalable so that everyone could have it at home. This is what I mean when I say that we need to get rid of these services and turn them into products or turn them into experiences. Now, I'll go a little bit deeper to explain to you what this actually means. What does it mean to turn a service into a product? Well, we need to innovate and transform these services to really make them scalable and less expensive, of course. And there was one great example which I loved very much, and that was Forward. Forward wanted to build the first billion-person healthcare system by turning healthcare into a product. That was what Adrian Aoun said, the founder and CEO of Forward. Now, if you're not familiar with Forward, they wanted to make these kind of cubicles that you could put basically anywhere. They're called care pods. And the purpose was to really make sure that at any given place, at any given time, you could walk in there and have some diagnosis done, check whether your health is okay, potentially if there is an issue, call with a physician. And the purpose was to put it pretty much everywhere. Now, the sad news is that Forward didn't survive. They recently announced that they needed to stop all their activities and they probably get sold. I hope they find something else. But it doesn't mean that the idea of turning a healthcare service into a product is not valid, because it works in China. If you look at Being a Good Doctor, it's pretty much the same idea where you can step into this cubicle, let's say, have a chat with a physician, maybe do some tests, and then come out of that cubicle and immediately get the right medication for you. There's about 10,000 of those Ping a Good Doctor cubicles set around the world in China. They're very close to supermarkets so that people can easily access them. But they're not alone. If you look at what Philips is building, they want to build that same idea, but put wheels underneath it and have it driving to your home. So basically, if you are sick, instead of having to go to that cubicle close to a supermarket, they are creating something which is called the health cap. And the purpose of that health cap is to bring it to you. It's a productization of what was otherwise a service. And they're not alone. If you look at what Samsung is doing, is they have created this sort of digital humans, which can be a doctor and who can listen to you when you actually need it. You don't need to wait for an actual doctor to speak to. You can talk to a digital human who is trained and who can help you and give you perhaps the first aid. And this is not a new idea because there's a lot of similar solutions that already exist. If you look at the NHS, they have this digital human assistant called Olivia who could actually help you schedule your flu vaccine. Or the WHO has Florence, which is a digital human who can help you quit smoking. Or in the Netherlands, there's Farmi, who can help you with some treatment advice for your specific pathologies. So what I want to see is, I want to see these services that we already have today in healthcare. When possible, I want to see them automated. I want to see them turn into products so that it is more scalable and that it is perhaps even less expensive. That is the purpose of turning these services into products, to increase access to healthcare. But of course, you can do the opposite as well. You can innovate and transform services into experiences. And the reason you want to do that is because you want to make healthcare better and more engaging. Because if you think about it, even if you are a patient, you are only a patient, or you only feel a patient a small part of that day. And during your day, you do a lot of other things. And while doing these other things, you might have really great experiences. You might deal with Amazon, with Netflix, with Siri, with ChatGPT, what have you all. And all of these experiences, well, they create customer expectations. And that's a very important thing. One of the things that I always say is that, sure, consumer and patients, they're not the same. It's a debate that has been going on in healthcare for a while. And I do agree. I mean, consumer and patient are not the same because their needs are entirely different. There's no debating that. But if you think about the expectations are exactly the same. Because in their life, they have similar experiences and they want to have that experience also in healthcare. So whether you are in a situation as a consumer in a supermarket or whether you are in a situation as a patient, perhaps in a healthcare institution, you have these exact same expectations. And that's very important to take into account because these expectations, they change rapidly. Let me go to the banking sector. Let me go back to the 1960s. This is a cash machine. It was called the yes machine because 24 hours a day, you can collect money from that machine. It was the beginning of the self-service experience, which was a completely new experience that did not exist before. In the 80s, the banking world moved into remote experience. You can call somebody and actually have some transactions made. You didn't have to go to a bank or you didn't have to go to a self-service desk. You could have it done remotely by calling. In the 2000s, we got the online experiences and you could do some transactions online already. You might remember these token devices. And as of the year 2010, more and more mobile experiences came about, which allowed you to have some experience nearby. You have more features, you maybe have some timely updates, which is very interesting back then. It was a whole new experience, mobile, thanks to these devices. We got wearable devices that came closely after, which made it even easier to pay or look at your banking or state accounts. In 2020, and it's been going on for a couple of years, not every bank has it, but more and more what we see is these kind of conversational experiences. We have chatbots with whom you can talk to have your quick, important, urgent primary questions answered already before you actually talk to a real person. And we are going into the area of full companionship experiences, where every bank will have your own personal companion with you that knows your situation and to whom you can talk to have a real understanding of your financial situation. So this was a quick overview, and let me just recap it real quick here for you. What we've seen is that since the 1960s until now, is that there's a lot of new experiences that came about in the banking industry, in the banking sector. We went from self-service to remote, from remote to online, to mobile, to wearable, to conversational experiences. And we are quickly moving into full companionship experiences. And why do I show this? Is because if you see this evolution, we really need to think about what is the healthcare experience that we are having today. And if we really want to turn these healthcare services into experiences, we need to think about how we want to do this. And I got the magic formula for you. Because if you want to create a customer experience, you don't only need to think about the needs, you need to think about the expectations as well. And this is one of the major mistakes that we make in healthcare, I believe, is because we think that there is a need and we found a solution that people will love it and that people will use it and that people will be engaged with it. But that's not true. It's not because it answers a need that it will actually be used by patients. You also need to take into account those expectations that your patients have actually experienced in other parts of their life, because they expect that exact same experience. And so if you look at the difference between consumers and patients, yeah, they're not the same because they have different needs. But you need to take into account that their expectations are exactly the same. And this is an opportunity because it means that we need to think about how we provide solutions to our patients. We need to think about how can we turn these services, which not always provide a great experience, which not always are engaging, how can we turn them into those experiences? And this is the right time to do it because more than ever, people have healthusiasm. They're enthusiastic about it. And so it's really important to create that experience because it is exactly what people want. And this is what we're seeing here. This is what I talked about when I said this is the healthusiasm trend. People are more than ever impacting their own health. But because there is such an interest in health and happiness and health and well-being, what we see is that healthcare industry is not the only industry that is focusing on health and well-being. More and more what we see is that other businesses who previously had little to no affinity with health and well-being are now moving into that health space. And you can see Accenture, Fast Company, the Future Laboratory, IDU, they all say the same, is that every business is a health business. Nielsen IQ even said that health and wellness is the single most powerful consumer force. This is how important it is. Havas did a study globally, and what they came to conclusion to is that 71% of people want to have their health and well-being improved by brands. This is something that brands need to focus on. And what we're seeing is that more and more people will be doing this because if you ask people, and this is a study by Ogilvy, is that what we want from certain industries related to our health and wellness, well, we don't actually get it. And so you can expect in the very near future that more and more companies will focus on health and wellness to actually close that gap. This is what we're seeing happening already today. I mean, this is a wonderful solution called Priya, which is on the market in Germany and the States. And it's actually a pill dispenser, a simple pill dispenser. But what you can see, that small face that you see there, well, it's also, a smart speaker. It's also a tool that allows you to do some teleconsultations with your physician or with your pharmacist. It recognizes your face, and depending on who you are, it will give you the right advice. It will dispense the right medication. Interesting. But more interesting is that it has been brought to the market by Black & Decker. This is how new companies who previously had no affinity with healthcare are stepping into the market of healthcare. And we see more things happening. This is Mercedes-Benz. And what they did in 2017, they brought to the market a fit and health car, which is connected to your wearables, which is connected to your smartphone, and which allows you to understand your current health situation while you are driving. Their purpose really is to make sure that you feel better after you've spent some time in the car than before. So if you drive for 3 hours, you might feel exhausted today when you get out of the car. Their purpose is to make sure that you feel better after 3 hours of driving. And they're not alone. There's so many companies that are focusing on improving the health and well-being of people. Renson is a ventilation system from Belgium who has one single objective, and that's making sure that the spaces in your homes are healthy. Deleuze Ahold is providing you with extra discounts if you are purchasing healthy products. Walt Disney even has these Zenimation movies where children can become calm again, where they become zen, where they can meditate even. What we see with all of these examples is that customers might have a certain need related to their health and well-being, and very often in the healthcare industry, it is met in a certain way, but not in a way that it meets their expectations as well. The experience in healthcare is not always that good, and that's why we see so many non-healthcare companies moving into the healthcare sphere, because they are certain that they can actually provide a better experience. And that's why we need to think about innovating for a better future. We need to think about how can we transform healthcare in the era of Healthusiasm, because our healthcare system is broken. Our healthcare system is broken. Our services that we provide that try to solve or answer certain medical needs, where they're too expensive, they're not scalable. But they also provide a very bad experience and they're not engaging. So we need to get rid of it. And we need to turn them into products that are less expensive and potentially way more scalable. We need to make sure that they are perhaps less demanding when it comes to engagement, but that they are less expensive. Turning service into products. But we could also do something else. We can turn these healthcare services and turn them into better experiences, which are way more engaging than the services are today. This is how you can create value. This is the experience economy. And this is really what we need to think about if we want to transform healthcare. Because if you think about it, the outside world is changing so rapidly. There's a lot of new experiences that people, patients experience every day, and they want that exact same experience also in healthcare. So we need to not only think about what are the customers' needs, what are their medical needs, but we also need to take into account their expectations, because then we can create that experience that they are longing for, that they actually might be more engaged with. Because patients and consumers are not the same, they have different needs, but they have the exact same expectations. And that's why we see so many other brands moving into the healthcare business. And this is something that we need to realize when we want to innovate in healthcare. Patients are more engaged in their health than ever before. This is the Healthusiasm I was talking about. 90% of the people, 89% of the people are taking more actions today than they were a year ago. People want to be healthy. This is a huge opportunity because health and happiness is the most important thing in our life. And that's why if you want to innovate in healthcare, we need to take it into account and do it now. My name is Christophe Jauquet. I'm a keynote speaker and an author. I'm the business strategist for a healthier future.